Nourish is a lake of data, and with that data, we've got the ability to deliver better care in an exciting way.
There is people that we support that can also use the system and do their own recording.
That's huge. I mean, that must add so much value to so many different people.
The real difference is about the impact it makes and the improved outcomes it can help build for the people on the platform.
It's actually amazing once you start monitoring people's moods, the trends that you can pick up.
Can we see trends? Can we start seeing predictable events? Can we manage risk better?
That for me is like gold mine stuff, because that helps us understand the people we're looking after better.
It just levels things up for us as an organisation.
We're really leaning hard into now, investing hard into what the possibilities are.
It just works a dream.
So, welcome to the Social Care Chronicles, the podcast from Rehability UK, where we explore the innovation, the lived experiences, and the future of social care. I'm your host, David Thompson, and today's episode is all about digital care planning. We want to make sure that technology is delivered is more person-centred, responsive and effective in supporting the adults we care for. And many of those live with mental health conditions, have autism, or have learning disabilities. So joining me today are two guests. First of all, we're here from Lee Gilbert, the Chief Marketing Officer from Nourish. Welcome. And obviously we'll be talking with Natasha Bone, who's one of our service area managers, and she has an amazing set of experience to bring to the table here. So both of you, welcome to our show, and we're so pleased to have you.
Good to see you. I'm really looking forward to this one.
Brilliant.
Thank you very much, David.
So we're here today to talk a bit more and a lot more about Nourish, the care platform, and how that digital care platform has really transformed what we do here at Rehability UK. So Lee, let's dive in. Welcome to the podcast. To start, can you tell us a bit about Nourish and what makes that platform unique and how it came into being in the world of digital care?
Welcome, David, and thank you for inviting me. I'm really looking forward to this one. Nourish has been in the space now for about 10 years. Our product came to market this year, is our 10-year anniversary in market. The business is nearly 12 years old, but where it originated from was our chief executive, Nuno, volunteering in care homes. Right. So he came from another space, but was very passionate at looking at technology and how it could really make a difference in an impact environment, particularly in underserved spaces such as social care. So he spent a lot of time, 12 years or so ago, volunteering in care homes, just seeing how they operated and looking at it from a space of how technology could make things better for care teams, sure, but also make things better for people supported. Not just, of course, from releasing time so that more time could be spent up front with those people being supported, but also in removing some of the paperwork and the bureaucracy. And I'll talk a little bit later on, I'm sure, about the real difference is about the impact it makes and the improved outcomes it can help build for the people on the platform. But Nourish today is a long-term care platform. So we serve a number of care types, ranging from elderly care, from domiciliary care, mental health, LD, and others. And many of our customers have got mixed care types. And Nourish has always been proud to be able to adapt its technology to suit the needs of different care settings up close. And that's been a core strength, really, of the platform since the beginning.
It's amazing to hear how so much has gone into that. But I've noticed you seem to have a real focus on designing Nourish around the people being cared for. So tell me a bit about how Nourish is built around that whole person-centered care approach.
I think I'll go a little bit upstream to your question with that one, David, in that we talk about person-centered care a lot in social care, and a lot of lip service sometimes can be given to that term. At Nourish, it means so much to us. It's a core DNA of our product, and always will be. And the way that we talk about Nourish, the way that our product team and our marketing teams think about the proposition and the way we position Nourish in the space is so centered around that person. How that shows up in the product is important, but also it being core to it, the way that we think about the development of that product is also equally important.
Right.
And if you think about a lot of technology, frequently technology in healthcare and social care and in other spaces is built around the user, and potentially bringing benefits to the buyer, the company, the commercial entity that's purchased that product, so they can realize those benefits.
Sure.
Our DNA and our reason for being has always been about the person supported in the center, and the way that the product has been built has always been driven with that in mind. So the number one core component of Nourish is the timeline.
Right.
And that timeline is really a key differentiator in our product. If you look at other products in the marketplace, they're very much built around interactions, yes, but also care activities, yes, but not necessarily the person first. And so that timeline is what the carer sees at the point of care on a device, and when they're interacting with Nourish, recording that care. And our platform is also designed so that the care teams can interact and encourage the person supported to co-create some of that evidence and be part of the evidence collecting. And you know, I've loved being in care settings where you see carers giving our devices across to someone supported and asking them to write their own notes or them to take their own photographs that then surface on their own timelines. So I guess that's the real core DNA, and it's about thinking from that lens in everything we do. So whenever we're thinking about new products, we're always thinking about how does this benefit the person supported first. And then, of course, you've got outside of that the care team and the family and everything else becomes next. You then get more broader into the care service and some of the importance around the value it brings at that point. But the value of Nourish will always be driven from the person in the center, and our product design is very much driven by that North Star.
Tell me about the early days of Nourish and the development process you went through to build that first iteration. How did that come around, and what were the challenges you faced when you did that?
I spoke earlier on about Nuno, our chief executive, volunteering in care homes. So that was the real beginning of how that went. But once we then started to think about the product and how that would come to life, it started another pillar of something that's deeply important to us as a business, and that is co-producing our technology with our customers, co-producing our technology with providers, and not just doing it in a tech room full of developers and building what we think is right. It's really important to do this in line with users, not just care teams, but with managers and also people supported, and get their feedback through that whole process. And we're right now going through a huge acceleration in our development and our product roadmap. And it's just been a pleasure to watch in the last 12 months the sheer number of customers that we now have working really closely with us. So in the beginning, we did that in a small scale, but today, 10 years later, the scale of that co-production of our product is off the charts.
Wow, fantastic. So what did you learn about testing the platform, and how did that testing and learning and evolving process, how did that really change the way Nourish was developed?
It's always important when you're building products, not only new features, but iterative elements, that there is robust testing in place. So clearly we've got UATs, user testing and beta testing and everything else that does happen during that process. But that's at a technical level. Let's just talk about it at the real impact and person level for a moment. When you're looking at it from that lens, it's so important to always be asking questions and probing in the differences that we can make and the impact that we can genuinely have by building the product in a certain way. So those key questions to providers, to care teams, to users, even people supported is what have we missed? What could we do better? And having that continuous improvement mindset is so important with that. And we're always keen to engage providers and users of our platform and even people supported for how we can do that ongoing. And clearly when we've got defined work streams that are development for specific projects, that's much more formal.
Yeah.
But we're always keen for that informal engagement.
Brilliant.
And you can't pretend to be genuinely building a person-centered platform without inviting that feedback on an ongoing basis.
Fantastic. So what sort of aha or penny drop moments did you have in the last few years that really have totally changed the way that platform is delivered, and something you've gone, actually, we really need to address that?
I think there's been several. In the beginning, digital social care and digital care planning was driven by a need to evidence care. It was driven by a need to take paper away from services so that care teams weren't running around with folders and managers weren't looking for information on a daily basis, and shift handovers were much more easily done. And that was the driving force there. So in the beginning, our product was built around that. But, true value comes beyond that. We can talk about cost saving all day long, and we could talk about evidencing all day long. And yes, that's important. And yes, that was the beginning of the product. But the aha moments, particularly now, it comes when you start looking at data, comes when you start looking at, can we see trends? Can we start seeing predictable events? Can we manage risk better? Yeah. And when you start understanding that and being able to surface that information in the product so that care teams can react to that information to avoid that fall, to avoid that event that might lead to an admission to hospital, right, to avoid something that might make a precious wound or something that would have a catastrophic event potentially, that's such an impactful thing to be able to do. So I guess the big group thing of aha gotcha things for us really was around how we can surface that data through dashboards, through information, and present that information in actionable formats. And we've done so much to this point to do that. But this next year, some of the things we've got coming up to really build on that are genuinely exciting.
Brilliant. So what sort of feedback process do you have now that helps you to plan and deliver those changes? You've just talked about those aha moments, those things that you suddenly you see some data coming out, bubbling up through your system, and you go, that's what we need to execute next. What is it that what's that feedback process like?
There's a bottom up and a top down process with that. There's, in terms of, I spoke earlier on about having regular feedback loops and conversations with customers and really co-producing the product with customers. And that is ultimately important. And asking them what the art of the possible could be, or what would make a massive difference in your world if Nourish was able to do that. So those conversations are important. Yeah. And our customer success team works really closely with our customers to dig into those areas and find out where we could deliver more value. But equally, we're always keen for our customers to come forward and we capture information for our product team to evaluate on ideas for new interactions or things that we could turn into from custom interactions into more baked library interactions. In other words, that would mean that other providers could benefit from them because they're part of a core library rather than just custom to that provider. Right. So those things and those loops are really key. So that's the bottom up. The top down element now is also us looking at the data we're surfacing and starting to challenge ourselves as what can we see in the data that no one spotted so far that could mean we can gain an edge, we can take a leading force on this, because it's important to be looking at it from both sides. So we've hired recently a director of data and AI. So we're looking to get at the leading edge of data and AI. And that team that's being built out there is very much looking at how we can use data, and yes, how we can use AI, both in a learning sense, but in a generative sense, and a predictive sense. And they're different uses of those toolings. But what it will allow us to do is to start seeing what that data is showing us that perhaps no one's really talking about yet.
Right.
And you start looking at things like predictive pieces. I spoke a little bit about that earlier on, but let's take falls, which is a huge thing in social care broadly, but there's other things that happen as incidents, of course, that we would all want to avoid and look to mitigate risk. Providers will always share with us ideas for how we could use data or surface data for them to make their lives easier. But actually also, we've got other data points that we can see that we could bring into the product, bring those data pipelines together and tell different stories to what users can see today.
Right.
So if we did that as the art of the possible, what may be the next phase that we could bring into this? So if we start looking at predictive events for a moment, you then start thinking about risk management and managing risks in settings and where we can add value in that. Now, that doesn't necessarily mean we'd be able to predict that someone in the next hour is going to fall over. That's a ridiculous thing to be able to do. But what it would allow us to do is to look in data for events that we've seen in people that have fallen. What were trends that you were captured in those individuals in the hours and days prior to that, which may be a mental health matter because of a family interaction or something that's happened outside of their place they call home, or it may be something to do with hydration and nutrition. It may be something to do with whether they've changed their diet or something that's happened that's always captured in Nourish. Nourish is a lake of data. And with that data, we've got the ability to really deliver better care in an exciting way. So I think it's, to recap, it is that bottom-up approach, working closely with providers. But that top-down element is where we're really leaning hard into now, investing hard into what the possibilities are. So the next 12 to 18 months of what we can build in that space truly is exciting.
It sounds like you're really digging into the deep data architecture, looking at the way what that's telling you as a story, so what the architecture is telling you. Then you're taking from that, okay, what can we learn? What can we bring to the fore? And how can that happen? Natasha, tell me a bit more about how you think the platform helps you support the people that we look after in learning disabilities or who have autism or have mental health care needs.
I think it's very much along the lines of what you were saying, really, and it's being able to look at those trends. The amount that we can record in the timeline on Nourish and for interactions. Really, and the fact that those interactions are, we can create them ourselves if they're not already there. So even if we see things that we want to start recording that maybe isn't there, or, that is particular to that person, we can create all that and monitor things.
Sure.
And I think being able to look at, from, being a registered manager, being able to look back at that and be able to look at, well, what was the reason for this is really important. I think that's what we love about Nourish, because we can finally look at all that and not look through trails of paper, that you've archived for the llike 12 months and stuff. Like, everything's there and reporting the systems on it. It just works a dream for like kind of progressing into that digital world of support plans, and daily notes.
Yeah, I love the time I spent with Stephen, who's the head of our quality, and he said, look, we spotted this great example. So this is like on a micro level. This is kind of what I love about the platform. It says, there's this guy who was eating, but he wasn't eating now and again, and they couldn't work out why he wasn't eating. And it turned out he didn't like casserole on its own, but they didn't know about that until they looked back through the timelines, looked back through what had been served, when it had been served, and more importantly, how it had been served. Turned out he liked casserole as long as there was plenty of mash with it. So for me, that for me is like gold mine stuff, because that helps us understand the people we're looking after better and helps us provide better quality care.
Yeah, I think we've used it in one of the areas that I oversee. I think monitoring epilepsy is huge, and the amount that we can monitor, in all aspects of a seizure, what it looks like, is in how often it is, if there's a certain time of day, certain day of the week, because you'd be surprised that actually a lot of these things could be really, really routine. And I think, and then delivering that information then to the people that we work with around us, CLDT, GPs, all of that sort of stuff. And when you sit and you look and you collate all that information, we have seen situations where we've been able to work with external professionals, especially medical ones, and actually improved people's epilepsy, because we can pick up a clear trend that without a system like this, it would have been really hard to pick that up.
That's amazing. And that's like real life changing stuff, isn't it, really? I imagine you've got some amazing stats about how much time Nourish can save people who are working in care environments. What does that look like from when you're looking at deep diving on the data?
Yeah, the data's always fascinating. I mean, we've got 450,000 people supported on our platform. So the amount of data that's collected and everything is significant. On average, 2 hours a week per carer is saved by using our platform versus not. So that is, is an important statistic, because that frees up more time to care. And that naturally means that's unlocking additional support that can be provided. Naturally, then it means that time has got to be used to create more valuable interaction for improved outcomes. And I said earlier on that time was always an initial metric for digital care planning.
Yeah.
These days, I tend to prefer to talk more about the improved outcomes rather than the time that's saved. But I do think that it's important to recognise that care teams have had to go through a digital transformation journey themselves to learn how to use technology. And I'd love to hear from Natasha about what that experience was like implementing Nourish, and how the teams found that journey of getting used to evidencing care through the platform. But it's always seen as being easy, even for those that are not finding technology as a friend normally. So it's always pleasing to see that our technology and our platform is really easy to use, and just unlocking that time is an important factor. But the ease of use is also key, because then that means that training becomes simpler, and it means that the ability to bring new carers into teams and get them up to speed with using the platform so that they can be supporting the people that they support more quickly is equally key. So, I mean, I'd be really, really interested to see what the experience of implementing Nourish was like, your side, Natasha.
Yeah, so I think in terms of me being one of the people that rolled it out, because I love technology, so I'm always super eager and keen to get away from paper. So, and I think we were really well supported by Nourish in showing us how to use it. To start off with, there was 4 of us in total that become super users. Brilliant. So taking all that information in, which we picked up super easy, and we thought, do you know what? If we can pick this up quite easy, I'm sure it'll be fine. So obviously, I think people are scared of things that are new. And it can be quite daunting. There's some people that are going to absolutely embrace it. There is some people who are going to go, I don't know about this, and I'm not too sure. So taking that into mind, I think we sort of like restructured what we were taught from Nourish to try and hit every avenue, and thinking about all the sorts of people that we've got, including the people we support. Because the fact that, there is people that we support that can also use the system and do their own recording is brilliant, and we encourage that wherever we go. So what we did then is we just kind of did it in areas. So we did trial, we did aspects 2, which is my area first, put it out, 40 people we support, 130 staff, lovely, nice kind of middle ground to kind of start the basis on. And I think the fact that, the way that the world is moving and the fact that we're always on our phones and we're all sort of this, once people have got their head around the concept that actually, if you can write a text message, you're going to be absolutely onto a winner, and structuring Nourish as a super user and looking at the individual and what we need to record for those people and programming it all in and timing it in, it really makes staff think about what they need to be recording. Whereas when we were writing with hand before, it's a generic sort of like notes box. And, that's sort of it. So we've kind of structured it so that we detail all the fine things. And within a couple of months, staff were just running with it. We couldn't have asked for any more. And then we thought, right, this is good. We're just going to keep going. So the rolling out for us was perfect.
Yeah. How much have you found using things like taking photos and uploading those into the care plans? How was that journey for the team?
That's been really good, actually. That's been really good because I think it's an area that maybe can lack because you don't think about it. But the fact that you've got the Nourish device, whether that be a phone or a tablet, and that's where you record things. So you've kind of got it the majority of the time. The fact that you can take it out, so you could be anywhere, and you can take a picture and you can upload it on, and it's all on there, and it's all looking lovely and brilliant. And I think it's really lovely then for people, families and, and all of that to look back on those photos and say, it's nice to see that people are happy and doing the things that they want to do. And it's a really, really good feature.
So Natasha, talk to me about how you set the Nourish system up to gather the data that really is most meaningful for the people that you're supporting.
So I think first and foremost is looking at that individual, the person we support, and thinking in a person-centered way and thinking about how we can support that individual for their individual needs.
Sure.
So, you can have there's so many bases that Nourish can cover everything in terms of interactions and how we record that data and things. So I touched previously on epilepsy. I think moods is also an incredibly good one. And it's something that's really simple to fill in, even whether it's us or whether it's the person that we support. And it's actually amazing once you start monitoring people's moods, the trends that you can pick up, know, and it could be, well, actually, it turns out that this person that we support has a really awful day on a Wednesday. And then once you start picking up on the Wednesday, then you can start looking back and saying, well, what was the day before? What happened the day before? How was the night before? And you can start picking back and looking at those trends. And in terms of setting up the interactions, are really simple. Yeah. And you can program them all in so that we're recording them on a daily basis, a weekly basis, and it could be anything. We've got epilepsy, we've got moods, we've got food, we've got fluid intake, weight, falls, behaviours of any type that might challenge, and it just continues to flow in the amount of information that is out there that we can record.
Yeah. So, I was really struck by when one of our other super users, Matt, told us that he really loves the real-time note-taking process. And he said it's just amazing how much free time that frees up for him and his staff. But I love also, can you actually record voice notes into the notes?
Yes, you can.
Wow.
So if you don't want to type, or maybe you find it hard, or spelling or anything like that, you can record instead, and it converts into text.
It's a speech to text technology.
Oh, wow.
One of the key advantages of that is it doesn't rely on the carer having perfect English. It doesn't rely on the carer necessarily being able to spell penicillin, for example, or any other word that may be more challenging to spell. And naturally, therefore, if you're working care teams that have got some neurodiversity in themselves,
Sure.
it makes their life easier to be able to deliver care and still capture those notes on there, because as long as you can speak into Nourish, it can translate that into text onto the care plan.
That's huge. I mean, that must add so much value to so many different people.
It does. And, you start looking at the ability then for recruitment, for workforce recruitment. It just opens up the types of people you can attract into your workforce to join your care teams, because it doesn't bring any barriers then to anything that Nourish needs, because as long as you can talk, that's all you need to be able to do.
Sure. And I'm sure you could then, some of the people we support who can verbalise and can tell their story, they could add their own voice notes too, couldn't they?
They could.
Yeah. I mean, that really brings it all back to the person we're looking after. And that's huge, because I think when I see a system like this in operation, I was kind of a bit blown away with it, really, when I got into the back end. And I was really struck on how that information can be shared. So, what's your experience with care providers and their linking it to other medical professionals and integrated care and to GPs, for example?
Yeah, so clearly the direction of travel for technology is more interoperability, and having system level awareness around the person. We're in a world at the moment of person-centered care that's very much wrapped into a setting.
Sure.
But the direction that we need to build into is that there's the ability to connect that data into GPs. So we have GP Connect, and that allows data to flow into a GP so that they've got some visibility of what's in Nourish.
Awesome.
And that GP Connect, it's a national program with the NHS, but what that does allow us to do is to really bring the medical professional into the circle of care within Nourish's environment, just as much as the family may be in that space, but they're there for different reasons, of course.
Sure.
But their ability to be able to visibly be able to see what's inside Nourish is important for them to be able to do their role within that circle of care with the person. Beyond that, there are other possibilities of interoperability that we need to keep pushing the envelope on. Sure. So you've got shared care records, you've got other areas that will allow us to connect into interoperable platforms. Clearly, we've got a partnership program that allows us to share data from Nourish into other technology providers, right, which are maybe within the setting itself, but also potentially outside of the setting, or at least allowing a window into that setting, such as families. So it is an important area for us. And, we have to recognize that in the next 3 to 5 years, technology from an interoperable system level perspective is going to be really key to just building more impact. But right now, today, GP Connect is such a fundamental piece for the medical professional.
So I'm assuming that once you've got all this connection and interoperability, got there in the end, I'm assuming that once you've got all of that, then sort of the live overviews and the live warnings and the live alerts that you can build on the system, do they start to come into their own at that point?
They start to become more alive. I mean, they're already very valuable even without that integration or interoperability. You've got the warnings and alerts that are there to nudge and to bring care teams aware of certain critical items or events that may need to be managed. But when you start then building out that integration with some of our partners, or you start looking at beyond that into interoperability, the art of the possible really opens up into what could potentially be valuable in the long run. But right now, we've got integrations with tooling such as Radar, such as Ultra, and other partners that we work with for remote monitoring and other vendors. And those things all show up on the timeline on the person within Nourish. So again, it's keeping it connected to the person supported, but it's widening out the lens of A, the data that can be collected, but B, how that data can then get used to really improve those outcomes.
Sure. And I think when I looked at the system for the first time, I was so impressed by the way that information can be centralized and then can be used by our quality team, for example, so that they could build audits effectively, so they could go ready with the questions they needed to ask because they'd been able to see the data before. How's that worked at sort of the macro level at Nourish as well?
The macro level is possibly the biggest differentiator of Nourish outside of the timeline around the person, which has always been the core DNA of the product. One of the things that allows us to differentiate ourselves in the market is that across care settings, across group level settings, across into headquartered operations, Nourish allows that data to be visible to everyone that needs it for roles and permissions that they may have within the system. Other alternative technologies operates in silos, and it means that even though you're recording and evidencing that care in one particular setting, the ability for someone at a macro level to be able to see that and understand that at pace and at scale is not something you can do. So it's always been a leading edge of our product.
Yeah.
And we're really proud of how that works with quality teams.
Yeah.
And quality teams are one of our key stakeholders to work alongside. They're one of our key stakeholders to co-produce our product with, to get feedback on the product with. And it really does benefit them because that gives them the ability to see into what's happening at pace, quickly, ask the right questions, delve into the issues, find root causes much faster. But even at a registered manager level, if you're a registered manager or an area manager, the ability to be able to remotely see into different care settings without having to pick up the phone or visit that setting and go through millions of pieces of paperwork as you would have had to have done many years ago, is transformational. So the macro is it's almost like hierarchical, if you like. You've got an immediate level at a registered manager where that's really surfacing. Then you've got an area manager, and then you've got a headquartered sort of various teams at ops and quality and everything else that just gives you tremendous insights. So again, it's roles and permissions based, and that's important, and it means that we can manage privacy and everything else that's key within the platform, which is another thing that we're very proud of. But the differences it can make, not just to care teams on the front line, but the ability to inform decision making and inform continuous improvement at group level is key.
Sure. So you kind of sit halfway between that. You're out there managing multiple services. Yeah. So how does Nourish make your job better?
Well, exactly like that. It couldn't have been said any better, because that's exactly how it works for us. So, based on roles and permissions. So for me as a registered area manager, I like to know everything that's going on.
Sure.
And things like with warnings, they're going to pop up. My Nourish is always going in the background. I see everything that goes on. I can look at it at any point. I think in an aspect for my job role, when we have inspections, whether that be CQC, whether it be PAMS inspections, local authority inspections, evidence is always something that is asked for.
Sure.
So, with the dashboard on there, with the reporting system, actually the time that it takes to put all that stuff together for what we're being required to evidence is a matter of moments.
Wow.
So it's so much more efficient. And then it's sort of, from me, it does go up that scale then. So, it will go to Anita, who is, head of operations for my area, and she has reports and compliance bits that she needs to do.
Sure.
So she can do all that from her computer for the whole of her area, so it gets bigger. So like I can only see Gloucestershire, she can see the whole of the Southwest.
Got it.
And then it just goes up and up and up the scale, and compliance can look at it and see all those trends, and it just works really seamlessly in terms of making sure that we're compliant, we're following our policies, we know exactly what's going on. Or, you know, it is lovely to know that as much as, you know, I'm in regular contact with my managers, I can also just have a look. So actually, I probably save them a little bit more time not having to pick up the phone and say, how is everybody? I can see it all right then, right that second. You know, if I was to look on there now, I can see everything that's happened this morning. And that it's so live and interactive, you know, and it alerts me when there's things that, you know, like, you really need to know about this. And I know what I'm looking out for, and I can see my little red bell at the top, and I go, right, that one's for me. Somebody wants me to know something and to be aware of what's going on. So it just levels things up for us as an organisation.
Amazing. And I suppose that really gives you a sense of confidence on the service that we're delivering.
Yeah,
which
absolutely.
You can then stand full square behind
Yeah.
and build better quality care off that amazing foundation.
Yeah.
That's really coming from your data.
Yeah.
It's really coming from that system. It's really coming from all the people who are dedicating every day those notes, those times, those interactions, those notifications, those alerts, and then putting the time in. So if they're putting time in, we're seeing that multiplied out in lots of different ways. That brings us to the end of part 1 of our conversation with Lee Gilbert and Natasha Bone on using Nourish to enhance digital care. We've only just scratched the surface, so make sure you don't miss part 2, where we will dive deeper into real-world implementation, overcoming challenges, and the future of digital care in our services. Hit subscribe, turn on notifications, and we'll see you in the next episode.